The state's supplemental budget is the spending plan to cover expenses through the end of the fiscal year. Good evening, I'm Brian Yacono.
And I'm Amanda Hill. This year, that means covering everything from a funding gap in the state's Medicaid program to money for protecting Maine's forests from spruce budworm infestations. Donovan Lynch has the latest as time to pass this budget is running out.
Hours before lawmakers try once again to pass a supplemental budget with bipartisan support, healthcare providers brace for the alternative.
This is unprecedented.
It's really going to ramp up the pressure.
At its core, the budget covers a $118 million funding gap in the state's low-income health plan called MaineCare through the end of June. The Maine House and Senate need to pass this legislation with a 2/3 majority in each chamber for it to take effect right away. That means votes from Democrats and Republicans. If this doesn't happen, the Mills administration warns that some MaineCare payments to health providers could be on hold starting as early as Wednesday.
Make no mistake, this will hurt Maine families. We really need to get this passed with a 2/3 majority.
John McAnuff is with Sweetser, one of the largest behavioral health care providers in the state, and one that relies on MaineCare for 65% of its funding. He says if the state starts holding MaineCare money, Sweetser may have to start cutting programs.
And we can sustain perhaps 30 to 60 days of cash a cash slowdown.
Well, the state plans first to hold payments to places like large retail pharmacies and on claims from hospitals of more than $50,000. Broader limits to funding are expected to follow. At places like Penobscot Community Healthcare, that could threaten the mission of caring for underserved populations.
That's not only challenging for the organization, but those are difficult things to reverse. I've never seen such disruption and potential disruption.
Preventing this is entirely in the hands of lawmakers, who must come together on an agreement that will lead members of both parties to back the budget plan. Talks have been underway, but the specifics remain under wraps. Republican Senate Minority Leader Trey Stewart says, quote, "We've committed to not negotiating in the press." Democratic Senate President Maddie Daughtry is hopeful lawmakers will meet the Tuesday deadline.
But the good news is that everyone understands we have to do this now. So fingers crossed tomorrow to go across the finish line.
For now, healthcare providers across Maine and the public are waiting with bated breath to see if lawmakers can come together Tuesday to accomplish their basic task of passing a supplemental budget with bipartisan support. In Augusta, Donovan Lynch, News Center, Maine.